Okay. I read that eating beef jerky can improve brain and memory function. Is it worth a try?
So, although beef jerky may be very tasty, I wouldn't recommend it. Of course, the high fat, salt, and preservative content of beef jerky can pose more serious problems than Parkinson's disease itself.
I also read that the more coffee people drink, the lower their risk of getting Parkinson's. I would gladly drink more mocha frappuccinos in the interest of helping the Parkinson's community determine if it could slow disease progression.
So unfortunately, I couldn't tell Sheryl why coffee drinking is associated with a reduced risk of developing Parkinson's. It's the difference between association and causation. So something can be associated but not actually be a cause of the disorder. For example, one study found that people with constipation were more likely to develop Parkinson's. So should we be telling everybody who has constipation they're at increased risk of having Parkinson's disease? Of course not.
So is that a no to my offer to drink more mocha frappuccinos?
Yeah, that's a no.
Okay, but what about findings that say longtime smokers are less likely to get Parkinson's than non-smokers? Should I start smoking or just try a nicotine patch?
You see what I mean? I have to prepare for her every single time. You'd be surprised how many people actually ask me that question. Can you imagine a doctor such as myself recommending that someone go out and start smoking or using nicotine patches when there's really been no scientific evidence that demonstrates that it does anything for Parkinson's disease? Furthermore, it's highly addictive and not a good idea, especially when we don't even understand why there's an association. Is that people who smoke die younger, so they don't reach the age where they'll develop Parkinson's? Or is there something about cigarette smoke itself? Again, we don't know the answers to this, so it would hardly be a wise suggestion.
Well, why don't most doctors encourage the use of alternative therapies, like hypnosis and herbal remedies?
Usually it's because they have not been documented. They have not been studied adequately to know whether they're safe and effective for the treatment of Parkinson's disease.
Well, until we have a cure, I'm willing to try almost any non-invasive therapy, though so far they haven't helped a whole lot. Massage cupping not only failed to reduce the edema, it left me looking like King Kong had planted hickeys up and down. I've heard that intravenous glutathione treatments and stem cells from China can cure Parkinson's disease.
See what I mean? Again, I think it's very difficult because there are all these claims, especially when you look on websites. And I think sometimes we end up grasping at straws that really fade away as soon as you look at the scientific reality of them. If something sounds too good to be true, it probably is. When a patient comes to me with a specific complaint, I write up a detailed instructions to address it. Should they return and they say they don't feel any better, I ask them what they have been doing with the medications. And sometimes it turns out that they decided on their own that they weren't going to follow the recommendations. And then I ask them, well, how's the exercise going? And they will say to me, well, they really plan on starting to exercise tomorrow. How can they expect to feel better? I can help patients break some unhealthy habits and I can make some recommendations. But patients have to participate as well in their own care.
Patients must understand that they are as much a part of their treatment as doctors and medication are.
Sheryl is one of those people who, when diagnosed with Parkinson's disease, took on the challenge of doing the best she could for herself.
With Cindy's encouragement, I set out to learn everything I could about Parkinson's and to slow its progression by exercising with a vengeance.
Sheryl has tried everything from Pilates, boxing, to aquatherapy, and the Nintendo Wii. In fact, when we play the Wii together, she usually beats me.
Boosting my exercise level was not difficult, as any activity I added was a significant improvement. I had spent my entire pre-Parkinson life avoiding exercise of any kind. In elementary school, I joined the library squad so I wouldn't have to go to outdoor recess. In high school, it took 3 friends to turn me over to do a forward roll. And when the time came to choose a college, I eliminated all those that had a PE requirement. So friends tell me that I'm in the best shape of my life, except for the fact that I have Parkinson's. That's a pretty big except, don't you think?
Well, in fact, now Sheryl exercises so much that I had to tell her, break the news to her, that she is overqualified for a study that we're doing that looks at the effect of exercise on Parkinson's disease.
I thought my gym teachers would be turning over in their graves if they heard this conversation. I looked around the exam room for hidden cameras or Alan Funt, ready to jump out and exclaim, "Smile, you're on candid camera." But neither happened.
As half of the doctor-patient relationship, we bear equal responsibility for making it work. Successful partnerships don't just happen. They require work on the part of both parties. So what can we do to make our relationship most effective? Bring a family member or a close friend to your appointments to take notes and catch things that you may miss. As we all know, 2 heads are better than 1.
And when Cindy recently suggested that I add levodopa to my drug cocktail, I heard that I was losing ground in my battle with Parkinson's. I know that Parkinson's is a progressive disease and that progressive diseases progress, but I had convinced myself that I would be the exception, that my commitment to exercise would enable me to hold the line forever.
Sheryl viewed my suggestion as an indication of worsening disease, when in fact I told her, "You're doing great." But it's the things that you're telling me about the limitations in your daily activity that led me to suggest that perhaps adding another medication could be of more benefit. You deserve to feel good, and sometimes it's levodopa that can help you feel good.
But what about the statistics indicating that as many as 60% of people who take levodopa develop dyskinesia within 3 to 5 years?
I think it's very wise for us to take these kinds of reports with caution and a grain of salt, because it doesn't mean that everybody develops it in that time period. Levodopa is a good drug. We have to be careful how much stock we put into something that's supposed to apply to all. We don't try to predict the future. Levodopa remains the gold standard medication for the treatment of symptoms of Parkinson's disease.
So I took the prescription, but I told Cindy I was not likely to fill it. She didn't push me, but she knows that when the time is right, I will do what I have to do.
Working with Sheryl is a team effort. If she isn't sure she likes what I'm recommending, we discuss it. Often I agree with her concerns and we may try another tactic. If I really feel that giving something a try is a good idea, I'm as stubborn as she is. And we usually will arrive at a mutually satisfying option.
I've met my match. Give your doctor a list of your questions and concerns as soon as you enter the exam room. Include symptoms and side effects you have been experiencing, changes in your health or meds, new stresses, and feelings of depression or anxiety.
Your doctor really needs to know these things in order to evaluate the effectiveness of your treatment and make the best treatment recommendations going forward. For example, when I ask the patient what medications they are taking, they'll tell me nothing has changed since their last visit. When I ask for the details, I find that what they were taking at the last visit and what they were taking at this visit may be dramatically different. But I wouldn't know that unless, again, somebody told me.
Another issue is our lack of familiarity with the potential side effects of Parkinson's medications. Some patients experience hallucinations, where they see people, children, or animals in an empty room, and they fear this means they are losing their marbles.
More often than not, however, hallucinations are a side effect of the medications we use and can often be treated successfully by adjusting the medications. This is a case where not telling the doctor can negatively impact care.
Certain medicines, as you've heard through this conference, can cause impulse control disorder, robbing people of their ability to control impulses like compulsive gambling and hypersexuality. I have a friend who became a compulsive gambler after starting on a dopamine agonist. Instead of being angry about the time he spent on the riverboats or the money he lost, his wife wanted to know why he didn't develop hypersexuality instead.